I've heard over and over again the need for diverse partnerships. Those are very difficult things to set up and to run. And yet, over and over again, that's one of the top needs that gets expressed. We have a world in which the demands for excellence in leadership are much, much higher than our capacity to produce the leaders to meet those demands. We see that here in the U.S., but it's not too difficult to see it on a global basis.
The thing that I believe at the end of the day is that it's the population at large that will have to rise to the occasion. But I don't think in these global environments there's anything that is going to give us any kind of certainty that all of the planned, formalized, governmentally controlled response capability is necessarily going to be any more than just a component in dealing with the disaster. I think increasingly, whether on a day-by-day basis or certainly in the case of pandemics, and to the extent that they get out of control and are going to be a function of dealing with them at scale, do-it-yourself medicine of some type is going to have to be intersected with that which the healthcare system is going to be able to do on the other side. And these are going to have to meet in the middle. It's only through the diffusion of these technologies at scale as a complement to the trained healthcare professionals that we're ultimately going to be able to have a global citizenry, independent of wealth to some extent, who can be informed, mobilized to some degree, and when left to their own devices, have some way of taking the knowledge that is being developed both historically and on a real-time basis and trying to be guided in how it can be applied in a very local way.
The public health should be given more attention, more importance, because from the scientific point of view, a good people in public health needs more training, more knowledge, more technology than I think a doctor or surgeon involved in the therapeutic medicine. Because you need to have the knowledge of medicine, of course, but also statistics, also economics, also humanity, social sciences. So from the interdisciplinary approach of point of view, I think a specialist working in public health should be even more competent than people involved in the therapeutic medicine. The diseases, the pathogens respect no borders. Therefore, we absolutely need mutual trust. We absolutely need transparency. If we don't know where's the problem, how can we deal with the challenge? How can we translate the challenges into the opportunities? It's just impossible. To build a wise leadership, to deal with international affairs like pandemic, I think we need to consider the differences of different cultures, different religions, different histories. But in the meantime, I think we should realize that there are universal values. This is the protection of the life, of the human life, of the ecosystem, of the environment. Protection of the right, of the human right, the right of expression, the right of development, the right of survival, and the right of sustainability.